Elena had perfected the art of being unremarkable. For 2 years, she'd worked at Morrison's grocery store without anyone learning her real name, her background, or why someone with her education was scanning barcodes for minimum wage. She preferred anonymity. It was safer than explaining how Dr. Elena Vasquez, former chief of neurosurgery at Metropolitan Hospital, had ended up behind a cash register. But when the store manager collapsed during the lunch rush, showing signs of a massive stroke, Elena would have to choose between maintaining her cover and using skills that could mean the difference between life and death. Some secrets were worth revealing. Elena adjusted her name tag, Helen, in block letters, and began her afternoon shift at Register 3. The lunch crowd moved through her line with practiced indifference, treating her like grocery store equipment that happened to wear a red vest. "Paper or plastic?" she asked Mrs. Chen, a regular customer who had never made eye contact in months of shopping. "Plastic, and hurry up. Some of us have real jobs." Elena nodded politely, her movements efficient and precise. Those same hands had once performed microsurgery on brain tumors, operating with precision measured in fractions of millimeters. 2 years ago, Dr. Elena Vasquez had been featured on Neurosurgery Today magazine for groundbreaking aneurysm repair work. That was before the lawsuit. Before Marcus Wellington decided someone needed to pay for his son's death during routine surgery. The malpractice case had been baseless. 3 independent reviews confirmed Elena's surgery was flawless and the death was due to undiagnosed genetic conditions. But legal truth and public perception were different things. The media painted her as reckless. The hospital forced her resignation. Her license was suspended and her reputation destroyed. Her savings drained by legal fees, she'd taken the first job that didn't require references: grocery store cashier. Store manager Robert Kim approached with his clipboard. "Helen, cover pharmacy questions when Janet goes to lunch. Just basic stuff. Where's the aspirin? Which cough syrup is cheapest?" Elena nodded, though the irony wasn't lost. She'd once lectured on pharmacology at 3 medical schools. "If anyone asks about drug interactions, just tell them to call their doctor," Janet added. "We're not qualified for medical advice." At 2:47 p.m., everything changed. Robert Kim was reviewing inventory when it happened. Elena watched from Register 3 as the 45-year-old manager suddenly stopped mid-sentence, his face contorting with confusion. The clipboard fell as he clutched his head. I can't," Robert's words slurred as he stumbled backward, his left leg dragging. Elena's medical training kicked in instantly. Facial drooping, speech difficulties, unilateral weakness, classic stroke signs. She had minutes before permanent brain damage. "Someone call 911!" Janet shouted, panic in her eyes. Elena moved from behind her register, her mind shifting into emergency mode. She reached Robert as he collapsed, breathing labored and irregular. "Sir, can you hear me?" she asked, kneeling beside him while assessing his pupils. "Unequal dilation, brainstem involvement." "Who put you in charge?" snapped Mrs. Patterson. "Someone qualified needs to take control." Elena ignored her, checking Robert's vitals. Rapid pulse, likely elevated blood pressure. His airway was becoming compromised as muscle control deteriorated. "Janet, I need a clean towel and keep everyone back," Elena instructed with sudden authority. "You're just a cashier," Janet protested. "We should wait for paramedics." Elena looked up, her eyes blazing with intensity. "He doesn't have time. His brain is dying right now." Something in her tone made Janet step back. This wasn't the quiet woman who scanned groceries. This was someone who knew exactly what she was doing. Elena positioned Robert to maintain his airway, using techniques perfected during thousands of emergency situations. She checked neurological responses, noting symptom progression that confirmed her diagnosis. "What's his medical history?" she asked urgently. "How would I know? You're not qualified to. High blood pressure medication, diabetes, heart problems?" Mrs. Chen spoke up. "He takes blood pressure pills, always complaining about cholesterol." Elena processed the information. Combined with stroke symptoms, this suggested a specific cerebral event requiring immediate intervention. Sirens grew louder, but they were minutes away. Every second counted. Brain tissue was dying, and Robert's condition deteriorated rapidly. She made the decision that would end her anonymity forever. "My name isn't Helen," Elena announced to the crowd. "I'm Dr. Elena Vasquez, and I'm a neurosurgeon." The silence was deafening. Even Mrs. Patterson stared in shock. "You're lying," Janet whispered. "You're just a cashier." Elena didn't have time to argue. Robert's condition was deteriorating: increased intracranial pressure, labored breathing, dilating pupil. "I need someone to elevate his legs and keep his airway clear," Elena commanded, transformed from submissive employee to medical authority. "When will paramedics arrive?" Mrs. Chen knelt to help. 3 minutes ago, they said 6 minutes. Elena worked quickly, positioning Robert for optimal blood flow while monitoring neurological responses. Her hands moved with practiced precision, checking pulse points with obvious expertise. "His stroke is progressing," she explained calmly. "The clot is likely in his middle cerebral artery. Every minute increases permanent damage risk." "But you're just—" Janet started, then stopped, watching Elena work with clear expertise. "I was chief of neurosurgery at Metropolitan Hospital for 12 years. I've treated thousands of stroke patients. Right now, Robert needs someone qualified, not someone worried about my credentials." Elena assessed Robert's motor responses, noting increasing left side weakness, classic presentation, but severe scope. Without immediate intervention, permanent disability or death. "Why are you working here?" Mrs. Patterson asked, condescension replaced by confusion. "Because sometimes life doesn't go according to plan," Elena replied, continuing assessment. "But medical training doesn't disappear because circumstances change." Paramedics arrived exactly when predicted. Their leader, EMT Rodriguez, immediately took control. "What's the situation?" Elena stood, her grocery vest incongruous with medical authority. 45-year-old male, acute stroke, 8 minutes ago, left-sided weakness, facial drooping, slurred speech progressing to dysphagia, pupils unequal, suggesting increased ICP, history of hypertension and hyperlipidemia. Rodriguez stared, then began equipment setup. "You medical?" "Neurosurgeon. I've been monitoring condition and maintaining airway patency." "Copy that, doctor. You probably saved his life. 8 minutes is golden time for stroke intervention." As they loaded Robert for transport, the store gathered around Elena with expressions ranging from amazement to shame. Janet approached hesitantly. "Dr. Vasquez, we had no idea. Why didn't you tell us?" Elena adjusted her Helen name tag. "Because sometimes starting over means letting people see who you are through actions, not credentials." Mrs. Patterson stepped forward, embarrassed. "I owe you an apology. The way I spoke to you was based on what you saw." Elena finished gently. "I chose invisibility. Today reminded me some skills are too important to hide." 3 hours later, the hospital reported Robert was stable, responding well. Early intervention prevented permanent damage. Excellent prognosis. By week's end, Dr. Patricia Williams from the local hospital visited with an offer, consulting position in emergency neurology, training EMTs in stroke recognition. Elena accepted with one condition. She'd continue part-time at Morrison's, not for money, but because she'd learned about work dignity and seeing people for who they truly are, regardless of circumstances. Sometimes the most qualified person in the room is the one everyone overlooks. Elena's story shows us that expertise doesn't disappear just because circumstances change, and the most qualified person in the room might be the one we least expect. If you were Elena, would you have revealed your identity sooner or stayed hidden? Let us know in the comments. If this story inspired you to look beyond appearances and treat everyone with respect, smash that like button and subscribe for daily inspiring stories. Thanks for watching. See you in the next one.